Hello, my name is Sergio Romero Jr., and I am a student of IVC, and this is my presentation of two pathologies that are from the integumentary system and the nervous system. These two pathologies are and alopecia, my bad, and depression. There you go. One pathology that affects the integumentary system is alopecia. Alopecia is an autoimmune disease that causes hair loss throughout the body. There are three types of alopecia. There is areata, which is the most common type of alopecia, which are consist of hair loss in patches throughout the scalp or on other different parts of the body. There is a second type of alopecia is totalius, which is the complete hair loss of the scalp. And then there is a rare form of alopecia, which is universalis uh, alopecia, which is rare and it's the complete or nearly complete total loss of hair on throughout the body. The causes of alopecia is when the immune system begins attacking hair follicles. Uh, Alopecia is both genetic and hereditary. It can be due to changes of hormones. It could be through hereditary from your parents, or it could be nutritional deficiencies. It could even be stress, and or it can be through the use of products containing certain chemicals. Now, the symptoms of alopecia are simply just a sudden loss of hair, and it's a sudden loss of hair. Most patients or most people diagnosed with alopecia are healthy or and fit, and that is the only. The treatment for alopecia is there are various types of treatments, typically known as Rogaine, a prescription cream that slows the hair losing process or the hair loss process. Propecia and corticosteroids, which are a cream that decreases the hair follicle inflammation, and immunotherapy, which helps the immune system from not attacking the hair follicles as often and helps reduce. There are you can either in corticosteroids, you can either do cream or injections, depending on what you prefer. And yeah, which is when the symptoms are more pronounced and daily activities are more affected and typically a bit long lasting for roughly a couple of weeks. And then there is persistent depressive disorder, which is less severe depressive symptoms but long term lasting. This can be years as we speak. Depression, the causes of depression is it has a variety of factors. Depression can come from genetic, biological, environmental, and psychological factors. And it could be from after a loss, as depression can be a form of grief. It can be from hereditary from your parents, in case if your parents are, or in family history, in case of depression is known in family history to run. And it could be from your environment, as we mentioned before, grief, a loss of a loved one. The symptoms of depression include feelings of sadness, feelings of losing interest, overeating or even undereating, isolating oneself, having thoughts of death or suicide, a change of behaviors and moves, typically more depressive or sad or hopeless type of behavior or mood, fatigue or loss of energy, difficulty concentrating, changes in appetite. Uh, these are all depression symptoms and cause symptoms. Treatment for depressions can be such as medicines known as antidepressants and therapies, most common therapies. It could be psychotherapy, it could be um therapy that helps you cope with loss, it can help you therapies that help you um with therapy. And so yeah, thank you very much. This has been my presentation for the two pathologies, and these are my references. Thank you very much. Have a good day. Okay, how can I stop this now?